Welcome to Becoming Parents Podcast. I'm your host, Jennifer Campbell. I'm a doula in Washoe County, Nevada, a Medicaid provider, a lactation educator, childbirth educator, and mom of 18. You can find me and connect on doulainreno.com. Remember, give a shout out to those who are brave enough to share their stories with us on how they have become parents. Let's dive in. Yeah. Welcome to Becoming Parents Podcast. I'm your host, Jennifer Campbell. Today, I'm with Jennifer McLean. How are you today?
I'm doing well. How are you?
So great. And when I saw your name on here, I was so excited. I want people to know how we know each other. I don't know how you actually found me.
Actually, CareSource
It was
recommended
through
you.
CareSource. Okay.
Yeah, so I work for Activate Care. It's a tech-enabled company where we have community health workers. We also partner with Medicaid and Medicare health plans to do some community health assessments, and then we do that to be able to integrate CHWs into communities. And so we were doing a project in Nevada with CareSource, a health plan looking to get Medicaid to be a Medicaid provider in Nevada. And they recommended you to us to talk because one of our topic areas was maternal health, and so they stressed you were one of the perfect people to talk to about that.
I love it. And you flew out here. You did all these interviews to do this case study, which isn't out yet. So spoiler alert on that. Nobody can, but it was really amazing. I got to meet you in person. We have a picture. It's all great. It's great stuff. And I want to share your story. You do not have children of your own, which I think is an exceptional doula demographic, which always, I mean, as I've been a doula longer and longer, at first I was like, why would somebody who's never had kids want to be a doula? And why would somebody want to hire a person who hasn't had kids? And I know you went through that. So I want you to just jump into your journey and how you became a doula and all of that.
Yeah, absolutely. So I had only heard about doulas in general, like at the age of 27. I never heard anything about doulas up until then. I thought that if I was always fascinated by birth. I always liked looking at the birth videos and understanding birth. But I always thought that if I wanted to work directly with birth, I would have to be like a nurse or a doctor. And that wasn't my path. And so when I learned about it, I actually learned about it from one of my classmates in my graduate program, and she talked about doulas and their special place on a birth team and all of that. And I just did my own research and was like, oh, this is perfect for me because I love birth, but also I'm a public health and a health equity professional. And so when you look at doulas and you look at the impact that they have on birth outcomes for mom and baby, that's public health and that's health equity in my opinion. So that's part of my work. And also on top of that, I'm just like a relational person, a very empathetic person. And then when I also learned about the statistics around Black women birthing, and then everything else, doula work to me just seemed like the perfect route for me to go.
And it is. And, the statistics are staggering and awful and don't make sense and aren't really, you can't really explain to me why. If we were both pregnant, you have a 3 times higher likelihood of dying than I do. There's nothing different about anything about us except the color of our skin. And so it's fascinating in a really bad way. And completely should never be an issue in my mind. And when you look at specifically health issues in different demographics, I think there's some information there that would lead, like, okay, there should be maybe a slight difference in just in general in a broad population, but not the levels of maternal and infant demise and the way you're treated. I've shown up at the hospital postpartum, which I usually don't do because there's been situations of prejudice and it makes me so angry. So angry. So I think that connection obviously for you that makes sense. Tell me about though getting what you were doing for your career path because you wear a lot of hats working for the company. So I want to make sense of the hats and how they cross over and then how you got into it and how you felt about getting into being a doula.
Yeah, so I'll talk about how I got into it first.
Mhm.
So there was a program. So I forgot to mention I'm in North Carolina.
Mm.
And so there's a program at UNC back in 2020 and 2021 that was specific training for Black women who wanted to be doulas. And the funding came along because of all of the horrific statistics around mom and baby outcomes. And so there was funding for this program to train Black women, and then we would work with Black families. And then the training was DONA International training, which is who I'm certified under. But then also there was a lot of culturally specific training and just additional training that a lot of doulas don't get.
Mhm.
So um, going into it, I was excited because it felt like, this is what I really wanted to do. And then honestly, after my first class, I was a little bit afraid
It's a
because there's
lot.
it's a weight on you, right? Like you feel responsible for this family that you're working for. In a way, you feel like you're there to help them have better birth outcomes, and so that's a big deal. But luckily the program also brought in, she's a psychologist, and she also does, like, I think she did inpatient and outpatient therapy, but she worked with us a week to week. And so your typical donor training is a 3-day process, but ours was like 6 weeks, Friday, Saturday, and some Sundays. So we got a lot of additional training.
Yeah.
Part of the program was also to just build that community, because a lot of people come out of those trainings and feel like, if I have a question, who do I go to? Is my
Hmm.
trainer accessible, or are my colleagues that I went through this with accessible? So this program, it was initially called Alliance of Black Doulas for Black Mamas, and then we changed it to Lead Doula as time went on, and we got additional funding, which is Lived Experience Doula. Um, and so, but this program again was solely for Black women to um, work with Black families and birth, Black babies. So it was a great program because I still have access. So the midwife that I trained under, her name is Dr. Venus Stander. She's a certified nurse midwife. And she has been awesome, and she has really just been a pioneer in our state and nationally, because she has the recognition of Vice President Kamala Harris. Um, she's called Venus out a few times about, the work that she's done. So we've been on PBS. We've done a lot of different things, and
Hmm.
she's been an exceptional leader. But I still have access to her. I still have access to a lot of my doula sisters that I train with, in my cohort and before us and after us. So it's really a great community that we have, and I think that's been really special for my journey, because I do acknowledge everybody doesn't have that.
Yeah.
And so my work doesn't really, outside of like my knowledge about birth and maternal health, my work that work doesn't intersect much with my full-time
Okay.
role. But I'm just considered like a subject matter expert if we are doing something around maternal health with a Medicaid plan.
I love
Mm-hmm.
that you are that. I think what
Yeah.
one thing that people don't understand is that when you're in birth work of any kind, it can be very isolating. And many women have their own trauma, either from their own birth or from their generational trauma surrounding birth and birth work. And that was a big thing here in Nevada too, is creating a community because it is so isolating, and you don't want to have, you don't want to, if you have your own trauma or even the feeling like you're not enough or you're taking all of this on, even if it's not trauma, it's just the, like you said, the weight of it, and you have no one to talk to about that. That's their doulas have like a 3-year burnout rate. And some of
Yeah.
it is pay and some of it is lack of support. So it's really, really important. It's very isolating. And yes, we reduce all these rates, which is amazing, but that's it's a lot of pressure,
It is.
especially in a hospital setting. I had a clip come out recently, a podcast I did with uh, my other business. With Tierra from the Phenomenal Mama. And it was like people want a home birth experience in the hospital.
Mm-hmm.
And although home birth and hospital birth do overlap a lot more than people realize, you're asking to have something in a place that doesn't really support it. And
Yep.
And so there can be a disconnect. Can you have it? Yes. Should you be able to have it? Yes. But
Mhm.
is it always probable? No, it's not. And how hard that is to want to give this experience to someone, but really feel like your hands are kind of tied. The other thing about not just a Black maternal health crisis, which it's definitely more than a crisis. I'm in Northern Nevada. There are no Black doulas. I
Mm,
represented Black Maternal Health Month last year, and then we did a second, like in July, a cohort and a panel, and it was great. And now I work with women on drugs or in jail, and I've never been on drugs or in jail. So just because I haven't been that demographic doesn't mean I can't help
yeah.
that demographic. But also, there is
Mm,
no question that a Black client would prefer you over me, and they
right.
should. And
Right.
so, I mean, I love your program because it expanded Black doulas.
Absolutely. Yeah, so the program is on their last cohort. Venus has trained 99 Black doulas in our state from 2020 to now, mainly in the Triangle area, which is Raleigh, Durham, and Chapel Hill. And then I think um, 80, I think at least 85 are certified
Mm,
through DONA, and a few more are getting certified in her last cohort. So she's done a phenomenal job. And there's a lot of other, women in our state doing similar work that Venus is doing. I'm just associated with Venus, so that's how I know more about her. But
yeah.
yeah, yeah,
I love it. Tell me about your experience as a doula because you kind of get past
mm,
feeling like imposter syndrome,
yeah.
right? I think we all, even if we go through births, there are certain situations I haven't been through. And I think imposter syndrome with people in their own business, period, is a big thing. It's something we have to overcome.
Mhm.
You hadn't had children of your own. So take me through that and your experiences with birth with families.
Yeah, so my very first birth, so because Venus was a provider at the hospital, she got a lot of um, last minute calls. We're like, okay, we have a mom that wants a doula. So my very first birth was a high risk pregnancy, um, which is
Perfect.
really crazy, right? But it's a good way to throw me in there. Um, but she was a high risk because, and she was in a different county, but she had been transferred to this hospital to UNC because they deal with high risk pregnancies, and she had fell and she was having some
Mm.
complications. And um, so my very first birth was a cesarean birth. But luckily we got OR training, operation room
Oh,
training. Yep. So we're allowed in the operation room.
okay. We are here
And
too.
yeah, and I know some doulas aren't. And it depends on the hospital. It depends on the
Yep.
program. It depends on your training. But we got that OR training, and so again, she was. They had induced her, and she was trying to still have a vaginal birth, but then things started tanking, and so
Yeah.
she ended up having to have a cesarean. And so but to be there with her, like I was there with her when she got her epidural in the OR. I was there with her. Like her husband wasn't able to come in until a certain point, but they let me in there for the whole
Yep.
process. And so I was just there holding her hand, reassuring her. And then when her husband was able to come, they did the surgery. The baby came out. He was beautiful and perfect. She got to do skin to skin in the OR when they were working on her, to make sure she was put back together
Yeah.
properly.
7 layers. It's like
Yeah,
7 layer dip here happening.
yeah,
It's a
it's a
lot.
lot. It's a lot. But her husband me and her husband was able to be there with her to support that skin to skin. He even latched a little bit while she was still there. The baby latched onto her for breastfeeding. So it was just
Wow.
such a beautiful experience. Yeah, it was a beautiful experience. Even though like that's not how I envisioned my first birth going, right? Um, and so since my first birth, so I've had 13 births in total.
Mhm.
Um, because I would love to do more, but it just is very time consuming. And so when you have a
Yes.
full-time job and one, I
I don't know how
I
you're doing
solely rely
births.
on yeah.
I don't know how
Well, I
you're
don't
doing
do
it.
that. Yeah. So and it's actually crazy because between 21 and 2022, I had 10 births in a year, working full time.
I don't even get how you did it. I don't
Yeah.
understand. Yeah.
Yeah. And so, but like you talked about before, that burnout rate is real. And so after that, um, I I didn't take many births after that, and I'm ramping up to take more births this year, but I really needed a break because it's emotionally and physically taxing and draining on you, right? But it's so beautiful and it's been amazing. But it takes a lot out of you. So I had to scale back a little bit. But that first year doing 10 births, like I saw so much, like when you're talking about like prejudice and discrimination. I had an incident, and it might seem subtle, but if you
Mm.
know that um, oftentimes they think that Black people don't feel pain as
I
much
know. I don't
compared to
even,
others,
it's just
which I don't know.
flabbergasting.
I guess our skin is thicker or something like that. So they like that's what they like to say, right? So I had a mom. She was trying to go unmedicated. She decided to get an epidural. They asked us to step out the room, and I was at this point. I was also working with a student doula, so it was she had two doulas, and her mom and grandma was there. And so she wanted her mom to stay with her for the epidural. So we all went out, took a break because it had been a while anyway. And then we walked back in the room. And normally when someone gets an epidural, you can feel it in the air because the tension is gone, right? She was still in extreme pain. And so I was like, did you get an epidural? Did you get the epidural? She was like, yeah, but I still felt everything. I'm in excruciating pain. She starts crying. And so the doctor comes in there. The nurse is like, well, let me go get the doctor. He comes in there and he's like, well, you look better to me. And she had literally just said, I'm in excruciating pain. And so um, he wanted to start her on something. And she's like, I can't do that until I get this pain managed. But she was to the point where she was crying and it was a lot. And so it's just like you see things like that and it might seem subtle like, oh, you look better than me, but she's telling you how she feels and you're dismissing that. And so I've dealt with some of that. um
Mm.
but overall, um I will say that, I've dealt with moms who had children who didn't have a doula, and then when I was there they said, oh, my birth was way better with you there.
Mhm.
I felt more comfortable. I felt like I'm getting more of what I want. And so as long as that's the end goal, that's
Yeah.
what's important.
I mean, I've talked about there are women who have planned cesareans because they've had them
Mhm.
before. They don't want to try whatever, right? Plan cesareans or they're planning on an epidural. So I'm not going to reduce rates in situations where that is the game plan, but I'm going to do
Right.
a whole lot of other stuff, extend the time before they get the epidural,
Yeah.
help position them better when they're pushing, help explain what it's going to feel like. I mean, I tell people, especially when they're planning an epidural, like I have Kindle Unlimited, I'm bringing books, I bring my laptop, and it's
Yeah.
not because you're not my top priority. It's because when you have an epidural, there's a lot less for me to do, but I'm still doing so much just in chunks spread out over time, right?
Absolutely.
And I love these women who are like, I want to bring my husband. He's the best support. And I'm like, 100% true. But he knows you intimately better than I ever will. But I know birth work, and you're putting all this pressure on your husband to give you the birth that you want in a situation where he knows nothing about it. And he's going to see the woman he
Absolutely.
loves more than anything in more pain than she's ever been in. And he's going to want to fix it. And
Hmm.
the hospital's going to come in and inundate you with decisions. And if you don't have a plan and he doesn't have a backbone to really advocate, which most people don't, that's not a put
Yeah.
down.
Yeah.
Your birth is not going to go the way you're going to get steamrollered. And then you're going to be angry, and you can't really be angry at your partner because he went into this not knowing
We didn't
anything
know.
about it. So, I mean,
Exactly.
yes, if you're making the experience better, I mean, there are times like I have a surrogate right now, and she's like, I don't really want postpartum, but man, does she need resources. And look, if all you need to do is have conversations with me on the phone, and I am sending you to the resource that you need, because you don't really need me to
Absolutely.
be there for an hands-on postpartum visit, like 100% I'm doing my job. That
Hmm.
right, there's so many ways that you can help. um I think also the medical professionals, because I recently had a white mom had an epidural and she said this epidural is not working, and the anesthesiologist is like, I mean, everything looks good, and I just went, wait, if she's telling you that she's feeling this and she has an epidural and shouldn't be, how can we troubleshoot this situation? Because I believe this mom. So I think sometimes medical professionals just disregard women in labor and delivery, period. And if your skin color is different, worse,
Yep,
worse,
absolutely.
more so. Um,
Absolutely.
Tell me more about the specific things you feel like bridge the gap in your education, because you're DONA is one of the toughest birth doula career, like as far as if you're getting certified through DONA, you have done a lot of stuff. It's not that 3 day people hear, oh, we did this 3 day
Right.
really intense. It's not that.
That's the training, not the certification.
A certification is like training's part
Yeah.
one, the easiest part. You have to do three
Yeah.
births, you have to document them. So bridge the gap on what lead does, because you said 6 weeks, 3 days each week. Like that's a ton of
Mhm.
class time, right? And I know you had the therapy. Did it help with like residual trauma, taking on the trauma that someone
Mm.
else did? Like what,
Yeah.
how did it bridge the gap?
Yeah. So outside of just that required training, we did a lot of like historical information on Black maternal health and like African and Caribbean roots. We learned about things like that. We also learned about acupuncture for our clients, or not acupuncture, pressure points.
Yeah.
An acupuncturist came in, but she talked about stuff that we could do. We talked about trauma. We talked about how to manage family. Like they gave us a lot of really hands-on training about like when I say manage family, just for your listeners, when you're in the labor and delivery room, or even before that or after that, sometimes family is great because they love you, but also like you just mentioned, they see you're in pain and they're gonna do whatever it is to fix it, or they're doing things that they don't realize is inappropriate, or saying. So we talked about so many different things, and so I think that really set us up for success. We did a lot of like hands-on stuff. We also talked about, and then with the therapy, it was like group circles where we did different meditations and things
Wow.
like that, because we talked a lot about self-care. um I don't think doulas get enough of that conversation. They think, oh, I'm just going in to help and do my job, but afterwards, after my first birth, that my first after my cesarean birth that I had a birth that lasted like 70 something hours. Like
Holy
it,
cow.
it was, yeah, it was close to 3 days. Yeah.
Mhm.
So I was up for a long time. And so when you're up for a long time, it takes your body time to recuperate. And
Mhm.
so we talked about it, but until I experienced it, I was able to like grab the things that I did, that I learned in my training. So they did an exceptional job of, like setting us up and doing those things that you don't typically get in your average training.
Which is that's so important. I think women, not that men, I'm not excluding men, but I think women and mothers do not take care of
Mm,
themselves. Self-care isn't like a day at the spa once a year. That isn't
no.
it. It's compound interest of doing a little bit all the time that adds up in your life over time. And when you're a birth doula and you're gone for 24 hours or 3 days, or like insert thing here, but it's not just the time. The time is one thing and the lack of sleep is one thing, but it's like it throws off my GI system
Yeah.
so much.
Mm-hmm.
I react in my gut, right?
Mm-hmm.
When I'm at a birth for a long time and I thought, is it the pants I'm wearing, like the scrub pants? Like what, how can I make this better? It's not. It's just how my body reacts. So how do you react in those on top of like lack of sleep and stuff, but you're also emotionally holding space for someone for a very long time,
Yeah,
and
yeah,
sometimes physically hip squeezing and like it's a physically demanding, emotionally demanding, and then
yeah,
sleep demanding job. Totally worth it,
yeah,
but it's
yeah,
very demanding. I want to
yeah.
compare notes on what we do. Like, what do you do leading into birth or to get yourself prepared for doing birth? What do you do afterwards and during? Like, how do you navigate that?
Yeah. So before birth, if something, if a mom is coming up and it's looking like she's going in soon, I always have a really good meal.
Mm.
I always make sure I have a really good meal because, when you're there for that long, sometimes you may, like you bring snacks or things like that, but you might not get a good meal. And for me, food is just comforting. So in order to just like get my mind together, I have a good meal. I try to sleep, but sometimes I can't because it's just,
I
the
know.
anticipation of it. And then I have a dog that's my only responsibility. So, I send her to my parents' house and just I make sure like I look back over the birth wishes of the mom, and I just kind of like whatever I need. Sometimes I need to, sometimes I just need to listen to music. Sometimes I need to, I just kind of listen to my body, and I figure out what I need, but it's always a good meal. That is always there. And then during or on my way, when I'm on my way, um, oftentimes like I'm listening to music, but then I also pray. And that's my personal practice, just
Yep.
like praying for a healthy mom, praying for a healthy baby, praying for a great experience, praying that I have everything or that I can get everything that I need to help and do my job. Um, and then when I'm there, when you're there, you do what you do. And then
Yeah.
afterwards, most of the time it's sleep because then I can finally really let go. And that's one of the things we talked about in our training. They said that, even when you have like a great birth, mom may get everything she wants to get, you have to learn how to let that go. And I realized that because my first few births, I just felt like for days and days and days, I was just like, okay, thinking about this, what could I have done better? What could I have, and that's okay to like debrief, but at a certain point you have to let it go because it's
Yeah.
over. And if you're a doula, you understand that
Yeah.
like having to let it go, even when it's the best birth, you still need to let it go because it can really like take over your thoughts because this is you're there with someone in their most vulnerable and intimate time of having a baby, and so it's a lot, and so you're thinking, but I've learned to like debrief, and sometimes I may debrief with a doula sister,
Yeah.
or someone like Venus, like even though I'm not doing births for her anymore, well I will be soon, which we can talk about in a second, but um if I've had to ask her a question, I might debrief with her because she's a provider, and then I've just found ways to let it go. So
I meal prep in my life generally, but
yeah.
I meal prep an extra 6 meals and I put them in my
Mm,
freezer. And
mm-hmm.
I think for my birthday, my husband got me like a better, I upgraded my lunchbox situation.
Yeah.
So I know I can go to the freezer and grab 2 things from the freezer, the yogurts, like I have a system. So I bring 24 hours of food with me so
Mm-hmm.
that I'm not like if you're grabbing snacks and running to the cafeteria, that doesn't help with my gut because I react the hardest in my stomach
Mm,
just from the stress of the situation. So I
right.
meal prep, and then when I'm down to two, I'll do an extra meal prep that week and put 4 more in the freezer. So I try to have 4 to 6 in the freezer all the time.
Yeah.
So I can grab, and that made it easier because obviously if they're frozen, they're staying cold longer.
Mm-hmm.
Um, and I have to give myself a shot every day. So I have like a it goes in the freezer, a little freezer pack for like shots,
Yeah.
injections.
Yeah.
So I keep that in the freezer, and I have two things in my birth kit that I charge, my speaker and my fan.
Mm.
So it's
Oh
like
yeah, yeah,
like
yeah,
bringing those things in, having them on a charger in a certain spot. So, if
yeah,
you get called in the middle of the night, I don't have to
yeah,
think about where is everything. My birth doula clothes, because I have like a
yep,
uniform, they're all in one place. My stuff that I
yep.
charge is in this place. My meal prep is in the freezer. Like you have to streamline everything so that when you get woken up at 2 in the morning, you're not scrambling to figure it out. And then I have these homeopathic, they're called stress relief, or I'll have to look it up. But if you're up all night and you get off in the morning or in the afternoon, my body doesn't want to sleep. And so
Mm.
I take these little homeopathic pills that help promote sleep without making me groggy. And
Mm.
I'll take a couple of those and I'll lay down. I can usually sleep for about 2 hours. And then I want to get myself right back on a normal schedule and go to bed that
Right,
night. So it's
right.
like with my stomach, because that bothers me a lot. When I get home, I'll take something for that to calm my stomach down. So I just think you have but that is self-care, right? Like all those things
Yeah.
we do to get ready, you eating that meal before you go. Like big
Hmm.
self-care, big self-care.
Yeah. And I
Yeah,
forgot I have my birth bag. So
right,
yeah, I always keep clothes and a change of like underclothes and
right.
all my materials and like little things that I use on my mom's like foam rollers and all that.
Yep,
Like I
all
keep all
that.
that together.
Yep.
And so yeah, and my birth bag I never take it apart.
No,
If
I
I
leave
need
it in the
to re
car.
Yeah, if I need to replenish something, I'll replenish it, but then I
Right.
just put it up because there's no point in taking it apart.
Yep, I leave it in my car. It's a rolling backpack. All I have to, I
Yeah.
never have to think about it. I just have
Yep.
to grab these things on my way out the
Yep.
door. And I think
Yep.
doulas don't realize like that is self-care. Having a system that's
Yeah, for
easy
sure.
before, during, and after, those are the ways that you support yourself. But I love that you said that you debrief because it's not a therapy session. And I've never felt like, well, there's been one time where I'm like, I might need a therapist for this. But
Mm-hmm.
I really just needed a more intense debrief.
Yeah.
And that is the biggest self-care, I think, to just say, I just need to unload this birth.
Mm-hmm.
um and there are situations where the only situations that I never beat myself up about the outcome, because you're doing the best you can with the people that you're working with in the situation with the OB.
Mm-hmm.
Like, have you ever been on a birth where one OB says one thing and then the shift changes and it's literally the polar opposite?
Literally. Literally the opposite. And
Literally.
everybody's confused. Like what just happened?
Yeah, I'm like, that's a weird vibe. And I'm like,
Yeah.
even two OBs working the same practice feel
Mm-hmm.
wildly different.
Mm-hmm.
Um, but there have been somewhere, because I used to do home birth only, and then I switched to predominantly hospital birth. Sometimes I think, how would this have been handled by my favorite
Mm-hmm.
midwife, Beth, love her?
Mm-hmm.
If this were a home birth, how would Beth have handled it? What would have gone differently, and when and how? And that's not like I want it unmedicated and I have a C-section. Sometimes if I'm there and we've hit that point, I'm in the OR. Like it's in the
Mm-hmm.
10% of births that
Mm-hmm.
should probably be a C-section. Otherwise, I'm going to say, if it's not medically necessary, if there's nothing urgent, can we try other positions and other things before? Like I've stood on my head. Like we've done everything we could before you go into that operating room.
Absolutely.
So it's not that, but sometimes I'm like, how would this have been different if it was handled by this nurse midwife and we had been at home? And
Mm-hmm.
those are the things that I think, looking at that helps me understand the differences in a hospital environment, period.
Yeah.
Right.
Yeah,
But
absolutely.
it's hard not to beat yourself up. Have you considered being a trainer?
No.
Oh, wow, that was immediate. I was like, we're going to go on this other tangent. Really? Why not? Because I think you're so good at
I
that stuff.
haven't. I
Wow, okay.
think I I
I think
think
I thought I was going to hit the mother load on that one.
no. I will say I think in the future, yes, I can see myself because honestly, ultimately, if I could just do birth work, that's all I would do. But
Oh, okay.
that's another issue because we don't get paid.
Oh,
Um, a living wage at, depending on what you're doing. And then also you can only do so many births at a time anyway.
Right.
So there's a lot that goes into that. So ultimately that's my dream, is to just do birth work. And so I could see myself doing, being a trainer or doing something in that. But for now, no.
Interesting. I did
Yeah.
32 births last year and I made
Ooh,
$24,000.
see. Mm-mm.
And that was gross, and that's before the $9,000 of write-offs. It's just, I don't
Yeah.
think, and granted, when you're doing Medicaid and TRICARE, some of the births I did last in 2024, I haven't gotten paid for yet, but it's still like I'd have to do 60 births a year and get paid for them in the calendar year to bring in the income. Like that's the other thing I think people don't realize when you're talking to someone who's self-paying, you're like, it's $1,500. I don't know what it is in North
Yeah.
Carolina, but self-pay is 1,500. And for me, and that's the average here. And if you pay it all at once, you can do three $500 payments or pay it all at once. I do a 10% discount. So it's 1,350. And they're like, that's such a financial investment. And I'm like, I should be getting paid 3 grand minimum, like,
Yeah.
like the amount of hours we do.
Absolutely.
We're getting paid like $8 or $9 an hour, depending.
Absolutely.
It's, so I get that. But that's one of the reasons I was asking about training. That's one of the ways that I've wanted to diversify. If you can do
Hmm.
this much in training and get paid for that,
Hmm.
then and this many bursts, then it kind of evens out. But
Yeah,
um,
absolutely.
so you're going to do more bursts now moving forward.
Hmm.
Are you,
Yeah,
and you're excited?
so yes, I am. I'm still gonna be a doula because I know a lot
Yes.
of doulas, like we talked about in the beginning, after a few years they're done.
Yeah.
But yeah, so Venus, the midwife that I train under, she's transitioned the organization, and so there's no more lead after this last cohort. Now it's a nonprofit organization called the Doula Exchange,
Oh,
and so we are partnering or working with Blue Cross Blue Shield North Carolina here to provide doula care to their federal employees, that their federal employee program that have Blue Cross, at no cost to the mom. And so it's right now it's in a pilot stage, but we are working in 12 counties here. Um,
wow.
and this program is for anybody. So it's not just for Black women. Anyone who is a federal employee with Blue Cross can utilize our services. And then the doulas can be from any demographic as well, as long as you're
Oh,
trained.
great.
Yeah. And so if you're trained, there's a different process than if you're certified. They
Hmm.
have approved 4 certifying agencies so far, which is great because, so a lot of times people just want to take DONA International because I guess it's the biggest or most known, but there's so many other certifying agencies that
Yeah.
are great. So they're taking 4 certifying agencies for doulas who have trained at those agencies, or who are getting trained under their process. And then for the doula, we have we get three prenatal visits, labor and delivery, and then 3 postpartum visits. And we're getting paid $2,200.
Oh,
And that is modeled after the blues in California. So North
yep.
Carolina and California have, kind of, North Carolina looked at California's
Yep.
program. And then your backup doula just gets $100 just to hold the calendar. And then if they have to step in, then they'll get the labor and delivery fee.
Right.
So it's broken up, but overall, if you from start to finish, if you're with that client the whole time, it's $2,200.
That's great because we get
Um,
1,300 here. And we looked at like Rhode Island, all the states that had gone through that. And I think at the time that we did it 2 years ago, it was fair.
mhm,
And it's not as fair,
yeah.
like, a couple of years in. But I'm so glad. That's so great.
Yeah, yeah. So we just did like the doula exchange program just did like a hard launch in November, and so now we're accepting clients. And so previously with lead doula, um, Venus would reach out to us and say who's available for this date. I have a mom that's due this date. Then we would get paired. With this program at the doula exchange, the mom goes on sees the doulas in her region,
Hmm.
chooses three that she can talk to, and then she decides which doula she wants out of the three that she chose, and then she
Yep.
also decides who her backup is. So it's a great program. We're just getting started, so we're really looking forward to like getting clients and seeing how this process goes. Um, so we can hopefully, because North Carolina has 100 counties, so the goal is to really serve the whole
Holy
state.
cow.
Yeah, the goal is to serve the whole state eventually, and then also have a postpartum portion of it too,
Yeah,
to get postpartum visits. Yeah.
I mean, we get postpartum, we get 4 visits and the birth, and we get $100 for each visit. So I do 2 prenatal and 2 postpartum. I do ideally,
Mm-hmm.
and then the birth is $900. Doesn't matter where it happens, or
Mm-hmm.
um, but postpartum doulas specifically that do shifts are not included in that. And that would be
Mm-hmm.
something that we would like to add here. I mean, there's a whole bunch of pieces of it, right, that you want to kind of make
Yeah.
changes to. We have a nonprofit here, so we send people there to do interviews with 3 people and pick one. They don't pick their backup, although they could. I mean, I always just ask, if you want me and you've interviewed 3, who would you prefer to be your backup doula? So yeah, I mean, interesting. I love the
Mm-hmm.
different ways that we do it. 100 counties, like that's insane. When you said
That's
13,
huge.
didn't you say 13? I was like, wow, you've got most of the state, but no, you do not have
No.
most.
Well, within those counties that
Yeah.
we started in is where the majority of people live.
Yeah,
So
right. I figured that. But yeah, I
yeah.
love the differences in it and just making sure that you have like a support network to
Mm-hmm.
get referrals, get
Yep.
paid,
Yep.
have backup, have community. Like those are all
Yep.
really important aspects. Jennifer, I love talking to you.
I
You're
love
so
talking to
fun.
you too.
Thanks for sharing your story. I love what you've been doing.
Yeah.
I love that I
Yeah.
know
Thank you so
you.
much. I know. Thank you for having me. I'm glad we met. I'm so glad we met.